with Miss K. If this is your first time visiting, welcome. My name is Kendra, aka Miss K. I'm a medical assistant instructor. Now I'm doing this video because it's been highly requested. So many people have asked, please do a video on lab values for the CCMA and vital sign ranges. So this is what this video is about. One thing I want to warn you guys is that the ranges may be a little bit different from your textbook, right? So one thing you'll see respiration ranges in a few minutes when we get to that. According to NHA, it's 12 to 20. Now, your textbook may say 14 to 20. That's just how it is. Like different websites you look at may be a little bit different. Lab values may be different, not drastically different. However, just don't be alarmed if you happen to notice a difference from what you see here versus what your textbook says. For homework purposes, you're in school, go by your textbook. Completing your homework assignments, use your textbook. And then once you are ready to take your CCMA exam, of course, you want to just go by NHA's material, okay? So let's get into it. First, we're going to talk about adult blood pressure ranges. Now, normal is going to be a systolic of 120 or less, and a diastolic of less than 80, less than 120, I should say, and diastolic less than 80, right? Both have to be true. Elevated, and this is a prime example of what I was just mentioning about your textbook may be different. In my student's textbook, instead of saying elevated, it says pre-hypertension. So they get a little confused once they get to NHA. And that's because it's just a little different. The numbers are still the same, but it's pre-hypertension versus elevated in their books. But anyway, elevated according to NHA is when the systolic pressure is between 120 to 129 and a diastolic is less than 80. So even if that diastolic number is good, so let's just say your systolic pressure is 120. Let's say your patient's blood pressure is like 126 over 74. Although that 74 is a normal diastolic reading, because that systolic pressure is between 120 to 129, it's going to be considered elevated. Okay. So it has to be, both numbers. So systolic is what did I say? I think I said 126 or 128. Diastolic is like 74. Something normal is still going to be considered elevated because of that systolic pressure being high. Okay. Well, not necessarily high, but you know what I mean, higher than the 120. Okay. Now, stage 1 hypertension, the systolic is between 130 to 139, or the diastolic is between 80 to 89. So if either one of those are true about the blood pressure, that's considered stage 1 hypertension. And I'm sorry if you guys can hear the noise in my background. I'm in my living room and there's an ambulance going past. So I'm sorry if you guys could hear that. But as I was saying, so stage 1, the systolic pressure is 130 to 139, or the diastolic is 80 to 89. So let's say you have a patient reading of 126 over 88, right? That's going to be considered stage 1 just because the diastolic number. So either or has to be true, because sometimes you may see a question that says, which of the following is considered stage 1? And because you see a good number for systolic, you may think, oh, that's a good blood pressure, but then the diastolic is high, then that's why it's stage 1. So I always kind of point that out to my students just to kind of get a heads up. Same thing for stage 2. If either one of those are true, it's stage 2. So if the systolic is higher than 140 or the diastolic is higher than 90, it's going to be stage 2. So another example, let's say you see a question that says, which of the following pressure readings is higher than is considered stage 2, and the answer ends up being like 136 over 94. And you're like, but wait a minute, the systolic pressure is actually just stage 1. But remember, either one has to be true. If that diastolic is over 90, that's automatically stage 2, even if that systolic pressure is pretty good. Okay. Now, one thing they did add with the new material is the hypertension crisis. Okay. The systolic is over 180 and or the diastolic is over 120. Now that's an emergency. In that case, the patient needs to go to an emergency room. Okay. So like I said, that's something that was just added, the hypertension crisis. But you guys probably know that when it's extremely high like that, patient needs to go to the ER. They need to be seen right away. Now, one thing I don't go over in this video, because I wanted to keep this lesson short, I'm not going over the pediatric ranges only because it's so much. When you go to your study material, you'll see. So it breaks it down by ages. So you might see 1 to 2, 3 to 6, 7 to 8, or, it's just so much to do in this one video. But definitely go to your study material and make sure you are understanding the pediatric ranges as well, just in case you see it on your test. Okay. And if you don't already have your study material, make sure you get it at nhanow.com. Same thing if you're taking the CMA or the RMA, make sure you are on the AMT website for the RMA material, and then for the CMA website, you're on the AMA site. Okay. All right, so that's your ranges for your adults. Okay, now you may see some questions about the pediatrics. I know for sure you're going to see the adult ranges, but um, definitely study pediatrics as well, because if it's on the study material, it's a chance you're going to see it. All right, so pulse rates. It was easy to include, of course, pediatrics with pulse and respiration rates because it's not as broken down as the blood pressure readings are. All right, so adolescents and older. Now, across the board, it's going to be 60 to 100 for adults, right? Adolescents and older, right? 6 to 15 years old, 75 to 118. 3 to 5 years old, 80 to 120. 1 to 2 years old, 98 to 140. And 1 to 12 months is 100 to 180. Now, and again, your textbook may be a little different. So you see that large gap of 6 to 15. Your textbook probably most likely says 6 to 8 or 6 to 9, and then maybe 9 to 12, like it breaks it down even more. So just a heads up on that. Don't be surprised if your book, if the ranges are broken down more than this. All right. So let's look at respirations. Okay. Adolescents and older, 12 to 20. Okay. So adults are 12 to 20. Again, don't be surprised if you see 14 to 20. 6 to 15 years old, 18 to 25. 3 to 5 years old is 20 to 28. 1 to 2 years old, respirations are 22 to 37. And then 1 month to 12 months is going to be 30 to 53. All right. So that's your respiration rates. Now let's look at temperature. Now, adults over 70 years old is 96.8. 6 years old to adult, 98.6. Okay. 1 year old, tympanic, 99.7. Newborn axillary is 98.2. And if you're looking at this, and especially if you've worked in the office, you're probably thinking, but we take, newborns, we take babies' temperatures regularly, which is true. But this is NHA's material. They did not. And maybe I could have possibly looked over it, but I did not see those ranges for rectal temperatures and all of that. I will say this, though. It was funny. I noticed it was funny that they put axillary, because I do notice that one of the questions, hint, hint, this is a test question from NHA X, which is the, like least accurate or, last result of a, or temperature site, and it was axillary. So I was surprised that they put that here. But again, this is NHA's information, so I'm just going by that. Okay. All right, so let's talk about the common lab values. Okay. So notice that the hemoglobin and hematocrit, the lab values are different from male and female. Even when you look at the red blood cell count, it's different from male and female. One thing too, I will mention, the 13.5 and 17.5, if you have seen the former study material, you might say, but I thought it was 13 to 18. That's just another example of the ranges being a little bit different. The information has updated. One thing about healthcare, things change, but notice it's not a drastic change. Don't worry. It's not going to matter, because it's not like you're going to see a question where you got to know whether it's 17.5 or 18, right? If anything, it's going to be way out of range, and you'll know. So like it may say hemoglobin for your male patient is, maybe it says 9, right? You automatically know that's too low based on the ranges. Or it may say it's 24, right? You already know, right? This is way off. So don't worry about it being different. The hematocrit is slightly different as well. Same thing. It's not going to matter. Now, one thing I will say, I want to point this out because you may have the same question my student may have when we were talking about these ranges. Like, what if the question just says, is hemoglobin normal? Because that was a practice test question. It didn't specify whether it was for male or female. But let's look at this, right? If you see a question that says a hemoglobin of, let's just say 9, right? And it doesn't say whether it's for male or female, well, 9 is abnormal for both. So it doesn't matter. Same thing for hematocrit. If it doesn't specify if your patient is male or female, if it's somewhere, let's say it's 60%, that's out of the range of both. So as long as you know what both ranges are, then it's abnormal, right? Or say it's like 20%, then that's too low for both. All right. So try not to, just kind of, some things are just going to be um just common sense, like, okay, either way, it doesn't even matter. I know it's low for either of them. All right, so CBC, white blood cells are going to be 4,500 to 11,000. Red blood cells in males is 4.5 to 5.9. Females is 4 to 5.5. And then platelet counts is 150,000 or 400,000. Now, glucose is 70 to 100. One thing I did notice is that it's a difference from the last study material. It said 110. Okay, so this will make a difference if you happen to, which I doubt it gets that close. If anything, you'll see something drastic like a 500 or something like that. That's way too high. But the former study material says 70 to 110. Now NHA says 70 to 100. I doubt you'll see a question where it's like 104 and you're like, wait a minute, this says 100. The former was 110. Which is it? It's usually always going to be something drastic. That's one thing that I can say, is that even though a lot of the questions are tricky and, you got to think, when it comes to these ranges and stuff, I've never seen anything that was really, really close, especially when they know that their study material differs, from one to another. All right, and then the hemoglobin A1C is below 5.7. Okay. Cholesterol, you have total cholesterol, which is 130 to 200. LDL should be less than 100. HDL, which is considered a good cholesterol, is greater than 60. Triglycerides is 40 to 150. Okay. Potassium, 3.5 to 5.1 MEQ per liter. Sodium, 135 to 145. INR, 0.8 to 1.2. So I know we were going over some study questions the other day, and it said a patient's INR is 2. That's too high, right? And then prothrombin time is 10.4 to 15.7 seconds. So as long as you know your ranges, that's it. Doesn't matter how they answer the questions. When you know your ranges, then whether the range is, whether the result is normal or abnormal. This is why you got to know your range. Okay. Now, urinalysis pH should be between 4.5 to 8. Specific gravity is 1.005 to 1.030. Urobilinogen is 0.1 to 1. And then any other values that you see there should be negative, like your glucose, ketones, protein, all of that. You want that should be negative. Okay. And so, guys, this is it. I hope that it was helpful. Make sure you like the video if you found it helpful. Subscribe if you're not already subscribed. If you want to see more content from me, share with your classmates and colleagues. Now, I do have a Facebook group called the Medical Assistant Lounge. Feel free to join it. There's people in there helping each other out and networking and things like that. Make sure if you do request to join, you answer the questions so you can be automatically approved into the group. Also, I mentioned before that I have medical assistant t-shirts you guys can check out on my website, Shop with Miss K, the collections, the MA collection. Also, I have one-on-one sessions that you guys can schedule by clicking the link in the description of this video. So I will try to do more video requests. I try to do them as soon as I get the request. If it's something I could easily do, let me know if there's something that you want to see. If I can do it, I will. One other thing I was going to share, but I just forgot. It'll come back and I'll probably make a post or maybe add it to the comment section of this video or the description. So again, if you don't have the study material, make sure you get it at nhanow.com or get the study material for whatever test you are taking. Also, make sure, I've been getting a lot of videos about study tips. Like, what should I do? I have plenty of videos on tips for studying for the CCMA. So before you ask that question in the group or on this channel, just make sure you search my videos. You'll see it. All right, guys. Hope you have a great day. Be blessed.